So the second question, what are some characteristics of our untrained athletes? Okay. So typically, the athlete we'll see, okay, come in. Remember, we get recruited from the top down. Okay, we'll have some great skill, hopefully, some good strength, some good power, some good conditioning. Okay, they may be lacking in that functional movement area. Okay, if we can get athletes that have great skill, great movement, and then lacking in the functional performance area, I get to look like a genius. Because that is so easy to make them into monsters. Okay? It's very easy to strength train people who are healthy. Okay? It's difficult when we have some dysfunction. Okay? Mike Boyle, heard him say this quote from a video series called Functional Strength Coach 2. Okay? Really changed how I train athletes in terms of injury reduction. Okay? Athletes tend to be much better at producing force than absorbing it. Okay? How often do you see people who can jump very well, but they land like crap? Okay? They can sprint, but they can't change direction. Okay? And if anyone was in the postural talk a little bit earlier and saw that ACL injury, okay, did that happen when she jumped or when she landed? Landed, right? Injuries occur during that absorbing force phase. Okay? So we've implemented a lot of force absorption into plyometric training, okay, into our agility training, a little bit of speed training as well, and this will go into our incoming freshman programs and throughout their careers so that we teach athletes how to absorb force as well as they can produce it. Okay? But why is that? Okay, again, Ray Cook to the rescue. The motor programs used to move and the motor programs used to resist are two completely different pieces of software. So it is a different motor program for us to produce movement than it is to absorb it. Okay? And if all we've done throughout our athletic career is produce movement, produce movement, produce movement, okay, when we come to absorb it, that neural system is going to be at a loss. Okay? So again, we need to train the body to learn how to absorb movement in order to be injury reduced, and also can help us produce some better movement as well. Okay? So when we're talking about movement, this comes from Cal Dietz. Cal Dietz has an excellent ebook. Didn't even wait for it to get published, because once you publish, it takes 2 years to get it done. Excellent ebook called Triphasic Training. If you work with high-level athletes, I highly suggest you get it. Okay? He says, and I totally agree with him, all dynamic movement is triphasic. So every dynamic movement, everything that happens in the sporting world is going to have an eccentric component, an isometric component, and a concentric component. Okay? And if we look at unfortunately you can't really see the colors very well. Look at the developed athlete, that's the inside lines, how steep those curves are, okay, in terms of the time it takes to produce that eccentric force, okay, and how short that isometric contraction is at the bottom compared to an undeveloped athlete, okay, ends up being just about the same amount of force, okay, but look how much longer it takes to develop it. Look how much longer it takes isometrically to move over to a concentric movement, okay? And then, even though that curve isn't as high, those angles are pretty similar, okay? So again, athletes, untrained athletes can produce it. It's the absorption that they have trouble with, okay? So another equation, okay? If we have functional force production and functional force absorption, okay, that's going to help that functional movement as well. Okay? So we need to train our incoming freshman athletes, okay, to improve their mobility, to improve their stability, and to improve their force absorption. Can anyone guess what type of training we're going to use? Isometrics. That's what we're here for. Isometrics. Okay? So, isometrics are muscle contractions with no visible movement of the joint. Okay? So coming from that, the Greeks, iso, same. Okay? Metric distance, same distance. So our muscles are contracting, our actin and myosin are trying to shorten. Okay? But the external load is too high to allow for any foreseeable joint movement. Isometrics have been used for a long time. It's not a new topic. Okay? Yoga uses isometrics. Martial arts uses isometrics. Okay? In the early 1900s, it was used a lot in bodybuilding. Okay? 60s and 70s, Eastern Bloc, Verkhoshansky, Yesith, etc. Okay? Said that throughout a training year, 70% of your time should be spent concentrically training, 20% of your time should be spent eccentrically training, 10% isometrically. Okay. There's two different types of training in terms of isometrics. Okay. Yielding, so that's where we're going to hold a static position, okay, while we're being opposed by an external resistance. Okay. So for example, I've got a barbell on my back, okay, and I'm holding a position as gravity tries to pull me down, okay, or overcoming, okay, I'm attempting to move against an immovable force. Okay, so since those motor programs between producing force and absorbing force are different, that kind of cuts that overcoming isometrics out. Because with that, we're producing, trying to at least attempting to produce movement. Whereas with using yielding isometrics, okay, we're trying to absorb force. We're trying to not allow that external force to overtake us. Okay. So we talked about the what a little bit. This is the how, and again, this is just how we do it. Okay. If you want to do it any different way, I've got no problem with that. Whatever you want to do. I just think isometrics are a great way to teach inexperienced athletes how to move properly within those movements. Okay? So, we typically do 4-day lifting programs. Okay? We cover the 6 main gross movements. So knee dominant movements, hip dominant movements, vertical press, vertical pull, horizontal press, horizontal pull. Okay? And that's kind of how we set it up. Our knee dominant movements can be divided into squat, single leg squat, split squat, and lateral. Okay? Hip dominant will get divided into a single leg deadlift, a bilateral deadlift. Okay? A movement that involves both hip extension and knee flexion, so any kind of leg curl. Okay, as well. And then this is the exercises that we'll use. Okay, the key thing is we're going to use the end range of motion point as the holding position. Okay, so for a squat, we're holding at the bottom position. Okay, for a chin up, we're holding at the top position. Okay, because this is the most difficult position. Okay, and we want to spend time in the hardest part of the movement. So quick video, okay. I should mention that also shows progressions and regressions. So this is our bottom hold push-up. Okay, if they aren't able to do that, we can incline them. If the body weight's too easy, we can add some load. Okay. Single leg deadlift, we'll start with a wall touch, teaching that movement, teaching them to be comfortable. If that's too difficult, they can have a little more balance, hold a bench. Okay. Eventually you want to get them loaded. Last example, chin up. Okay, again that top position, sternum touching the bar. Okay, if it's too difficult, we can use a band or a partner from assistance. Okay. Pretty simple to progress it, we just add some loading. Okay, so that's some of our volleyball players. Grabbed them right in the middle of the lift and made them do extra, so I appreciate that. Okay. When we're training, okay, we typically do 2 to 4 sets. The reason for even number of sets is if we do a single leg or single arm movement, we'll do 1 set on the left, 1 set on the right, so just to even it up. Okay. Anywhere from 30 to 60 seconds we're going to be holding for. I prefer to stay on the lower side, the 30 seconds stay the side, and I'd rather load them up as opposed to keep adding volume, volume, volume. Okay? Pretty low loads. You know, most of the time we're starting them with body weight. Okay? Our good athletes can get up to somewhere between 30 to 40% of their 1 RM for a 30 to 60 second hold. Okay? We're going to do this for 3 to 6 weeks. Okay? I'll show you in a couple more slides, but we have kind of goals for them to meet. Okay, so I send that freshman program home to them. Okay, they get it. If after the end of those 3 weeks they can meet all those goals, they're allowed to move on to the next phase. If they can't, we'll do another week. If can't, do another week. Okay, once we get to that 6-week range, okay, effectiveness starts to wear off. We got to do something different, and we can always come back to it. So the what and the hows, now the why. Okay, why are we doing this? Okay, so obviously we're trying to increase mobility. Multiple studies have shown strengthening lengthened muscle increases joint range of motion more than static stretching. Okay, so if we're trying to improve their mobility, okay, isometrics is a great way because we're strengthening them. Remember, always at the most difficult, the lengthened position. Okay, so we're getting mobility training with every set. Okay, stability. Okay, remember, stability is dynamic muscle or body control. So if we're controlling the body in the most difficult position of that movement, I'd like to think we're getting some pretty good stability out of it. Okay. Other benefits, talk about greasing that groove. Okay, spending time under the bar. Okay, well, we're spending time under the bar at the most difficult position. Okay, so we're taking time to be in that tough position. Now when we go to do a full movement, okay, that tough position's kind of been taken out of the equation in terms of being nervous about being that low, nervous about being chest right up against the bar, things like that. Okay, we're improving posture. Okay, so obviously when they're at home, we have to teach them a lot before they start doing that movement. If they're doing those movements in front of me, I'm constantly cueing posture. Okay, posture is huge. Okay, posture is huge for mobility. Okay, kind of got my thunder stolen a little bit. We already did this in the posture lecture, but if everyone just hunches over, okay, I want you to try to turn to each side as far as you can with your spine. Okay, same thing. Pull that spine straight up. Look how much extra mobility we've got. Okay.